Hello, my name is Kylie Bunker, and this is my presentation for my senior capstone portfolio. So I'm currently a senior majoring in public health with a minor in nutrition, with a very strong interest in improving health outcomes through education, prevention, and access to resources. And throughout the program, I've developed skills in communication, program planning, and data analysis, helping me understand how public health works in the real world, especially when addressing health disparities. And looking ahead, my goal is to become a registered dietitian where I can work one-on-one with individuals to build sustainable, realistic habits that support overall health and well-being. This slide highlights the key skills I've developed throughout my public health program. At the center is communication, one of my strongest skills, as both artifacts do require me to present complex information in a clear, practical way. I've also built skills in program planning, data analysis, and collaboration, learning how to assess community needs and design interventions, and especially work effectively in teams. Overall, these experiences have prepared me to enter the public health field and work further toward my goal of becoming a registered dietitian. So overall, my senior capstone portfolio reflects my growth as a developing public health professional, bringing together projects that apply what I've learned in real-world contexts. For this presentation, I focus on two key artifacts aligned with Program Learning Outcome 1, which is communication, and Program Learning Outcome 4, which specifically focuses on program planning and implementation. So together they demonstrate my ability to communicate health information effectively and design solutions to public health challenges. My first artifact that I chose for Program Learning Outcome 1 is a group presentation on the rising cost of life-saving medications, specifically insulin and EpiPens. Completed in my health organization policy course, the project involved a full policy analysis of a real public health issue, including the scope, key stakeholders, and potential policy solutions. A major focus was not just understanding the issue, but also communicating it clearly to a general audience. And since medication costs impact so many people, we definitely aim to make the information clear, impactful, and relatable rather than just overly technical. So for this project, I was involved throughout the process with a primary focus on developing the problem and impact sections. I carefully examined how rising medication costs lead to issues like rationing and disproportionately affecting lower income populations. And I also helped organize slides and ensure that the visuals were clear and easy to follow. Since it was a group project, I did work very closely with my team to edit the content and maintain a smooth, cohesive flow. The project really strengthened my ability to break down complex public health issues into clear and understandable ideas. One of my biggest takeaways was just how strongly financial barriers impact health outcomes, showing that even effective treatments aren't always accessible to those who need them the most. And it also really shifted my perspective by highlighting how policies and larger systems shape health, not just individual choices. So overall, this experience improved my communication skills and ability to think critically about real-world health issues. My second artifact focuses on Program Learning Outcome 4 and is a program planning project called Nourishing the Future. It aimed to improve nutrition among mothers and young children in rural Utah by addressing barriers like limited access to healthy foods, lack of nutrition education, and cost. Unlike my first artifact, this project focuses on creating a full program rather just analyzing a specific problem. For this project, we followed the generalized model for program planning, including needs assessment, goal setting, intervention development, and evaluation. We used both qualitative and quantitative data to understand community needs, identifying key barriers like cost, access to healthy food, and limited awareness of resources. And based on this, we designed realistic community-focused strategies that emphasize education and improving access. And I think that this experience really helped me better understand how to build a very practical and effective public health program. I contributed to the needs assessment, analyzed survey data, and helped develop goals and SMART objectives to guide the program. We also applied social cognitive theory to ensure that our approach was grounded in behavior change, and this project really strengthened my skills in data analysis, teamwork, and especially program planning. It also really showed me how complex public health issues are, highlighting the importance of factors like environment, access, and social support, as well as the need for collaboration. And so overall, I really believe that it gave me confidence in turning research into practical, real-world solutions. After I graduate in May of 2026, I plan to start applying for entry-level positions in the public health or nutrition field to gain more hands-on experience. And long term, I plan to pursue a master's degree in dietetics and become a registered dietitian. My goal is to work more closely with individuals and potentially in a clinical or private practice setting to help support long-term sustainable health habits. Overall, this portfolio really reflects my growth in the public health program, highlighting my development in communication, critical thinking, and program planning. It shows how I've applied these skills in meaningful ways. And these experiences have prepared me to enter the field with confidence as I continue working toward my goal of becoming a registered dietitian and making a positive impact on health. Thank you.